Medical Affairs in Alkem, and on behalf of my Alkem team, the Burgeon team, I will like to welcome all the delegates today for today's session on nutrition and growth. Let there be light. To take this session, we have a very eminent faculty with us, and I'd like to welcome our today's faculty, Dr. Prashanth GOWDA. He has done his MBBS and then post-graduation in pediatrics, and that post that neonatology. Apart from that, he has been fellow from various well-known universities like Boston University, Johns Hopkins Hospital, Baltimore, and he is also graduate from Harvard Business School. He is past secretary of National Neonatal Foundation Karnataka, and currently he is HOD and consultant at Pediatric and Neonatology Department at Motherhood Hospital, Bangalore. Now, Dr. Prashanth GOWDA, he comes with a vast experience in the field of neonatology and pediatrics. His expertise in handling extreme babies, sick babies, and clinical management of low birth weight, very low birth weight, and extremely low birth weight infants. His special interests are neonatal ventilation, pediatric nutrition, chronic lung disease of premature babies, care of surgical neonates, antenatal counseling, and neonatal point of care ultrasound. And other areas, he is extremely interested in training and training the students, as well as training the doctors, pediatricians. Apart from that, handling emergency pediatric and pediatric growth and development issues with vaccination. He takes great satisfaction in motivating his colleagues, and he provides highest levels of expertise and which is value for our even smallest of the patients. He's very well known TEDx speaker. He's actively involved in teaching trainers of registrars, junior doctors, nurses, and apart from that, he has immense interest in research. He is been speaker in various national and international conferences across India as well as across globe. So welcome, Dr. Prashanth, and over to you for the next session. Thank you.
Thank you, Dr. Roshan. Today we're going to go through a brief things about the nutrition, which is a building block for a great nation, a quality nation, because good nation comes with a good breed of the young generation who determine the outcome and who determine the overall, they are the health indicator for the nation. So many things can wait, but children can't wait. Today, their bones are being formed, their blood is being formed, their senses are being formed. And to them, we cannot say that you wait till tomorrow. The name is today. Just give me 1 second. Just give me 1 second. So we cannot say that let the kids wait. We are busy today, and then we will care you tomorrow. So it's not going to happen that way. So nutrition and growth, let there be a light on that. To give a brief introduction, I mean, most of us know in our day-to-day practice, the first question which every parent, when they come for vaccination, when they ask is my kid normal? Is his growth normal? Is nutrition normal? Doctor, I feel my kid is not growing well. My kid looks very thin compared to the neighbor's kid or my relative's kid. So they will have their own parameters in terms of assessing their growth, their kids' growth and development. But as a pediatrician and as a medical personnel, we need to guide them with the WHO recommended aspects of growth and development, why the nutrition is important. When we say nutrition, it is not just the nutrition what we see in terms of weight. It is also nutrition in terms of, we have something called as macronutrition, micronutrition. which we need to focus on, and we need to guide the parents in terms of making them understand that for a overall a complete growth potential, if you want to extract from the kid, we need to provide this basic things of macro and micronutrient components in an appropriate age recommended doses. So children, as I said, are our future because they are the 1/3 of the population. And even when Corona was hit and when vaccination drive was started, till now, we are worried that what if our kid gets affected? What should be done and whether vaccine to be introduced right away or not. So every nation is worried about their younger generation because they constitute almost 1/3 of their population and they determine the health of the nation and they determine the quality of the upcoming generation. So growth is the best global indicator of children's well-being. And we all know that the growth and development of kid, it is the combination of various factors: genetic potential, nutrition, safety of the environment, social interaction, stimulation. There has been a study which is done where if two plants are made, planted in a pot, and if you go on giving love, tender care for one plant, and if you go on giving abuses on the other plant, there has been a growth stunting in that plant as well. So any life creatures, and especially human beings and kids, it's a combination of social interaction, stimulation, love, tender care with appropriate food, which will actually help in bringing the best potential in terms of growth and development in the kids. So across 184 countries, the rate of preterm births are around 5 to 18%. And in India, out of 27 million babies born every year, 3.5 million babies are born premature. And the newborn deaths accounts to almost 40% of all deaths among under 5 mortality. And we know that in that first 1 week of life is crucial. And that first 1 week of life, which is actually determined by the health of the mother. So nutrition of a baby starts right from conception, right from the nutrition when the couple thinks of, when they think of becoming a parent. That is the time when, we need to check the hemoglobin status of the mother and other nutritional status of the mother. If they've got good nutritional state, when they conceive, the baby will have, or the fetus will have a very good growth. And it has been observed that maternal nutrition plays a very key role in the outcome of pregnancy, as well as there is something called a fetal onset of adolescent disease or fetal onset of adult disease, which are quite common in kids where the maternal nutrition has been severely hampered or affected. So nutrition starts right from the mother, and after conceiving, we need to be very careful and we need to guide the mother about appropriate nutrition, which she needs to take throughout the pregnancy, and supplements which we have to advise them, whether it is iron supplement, folic acid supplement, calcium supplement. So this all plays a vital role in terms of bringing the best in the fetus, and also plays a vital role in terms of having a successful outcome post pregnancy or delivery time. So we all know that children have their specific growth phase. The growth of kids are not same throughout the life. And if, for example, we have 3 growth phases. One is an infantile growth spurt, mid-childhood growth spurt, and adolescent growth spurt. So infantile growth spurt is a time when they grow 4x, 4 times. If the kid is 2.5 kg, they become 10 kg by end of 1 year. This amount of rapid 4x growth does not happen again henceforth in the life. So 0 to 1 year is very crucial. And in that first 3 months, they gain almost 1 kg per month. And 4 to 6 months, they gain around half kg per month. And 6 to 12 months, they gain around 200 grams, 200 to 250 grams per month up to 12 months. And then 1 to 5 years, they gain around 2 to 3 kg per year. For example, if the growth would have been same, like 1 kg per month, they would have been 20 kg by 1 year, 100 kg by 5 years, and 200 kg by 10 years. So nature does not allow an excess growth, and at the same time, it gives that space of growth, wherein if you provide adequate nutrition, we'll be able to extract that potential from the kid. So 0 to 1 year being a crucial time where the growth is almost 4 times the birth weight, focusing on the nutrition of the mother, focusing on the exclusive breastfeeding, focusing on importance of exclusive breastfeeding and complementary weaning food advice, because most of the Asian kids, they are prone for micronutrient deficiency between 6 months to 2 years, because that is a time when we switch in addition to the breast milk to the complementary food, where the diet is missing with most common micronutrient deficiencies, iron deficiency, which we see in our Asian kids. So it is important that we need to emphasize on the micronutrient of iron, calcium, vitamin D, because baby is growing. Baby body needs various micronutrients which will help in their adequate growth and development, which we expect for their appropriate age. So 6 months to 2 years being a crucial time where giving adequate advice to the parent makes a huge impact in their outcome. So 0 to 1 year is the infantile growth spurt, and next we have mid-childhood growth spurt, that is between 4 to 6 years in few kids, or 6 to 8 years in few kids. That is a time when again the growth will increase and growth will be more, and their demand for nutrition to the body will also go up. And the third phase of growth phase is at the adolescent growth spurt, that is between 10 to 12 years, 2 years prior hitting the puberty in girl baby, and 2 years after hitting puberty in boys baby. It could be 10 to 12 or 12 to 14. It varies in kid to kid. So this is the time when they grow very rapidly and their nutritional need has to be met according to their, the growth spurt. So in between the growth spurt, they grow slow, but that doesn't mean that they don't need nutrition. They need continued nutrition at an appropriate recommended dose, which will help them to sustain and helps to reach accelerated growth when the growth spurt period starts. So inadequate nutrition in first 1,000 days can cause huge impact in their weight, in their length, in their overall development. Nutrition not only causes, malnutrition not only causes stunting or the loss of weight or inadequate weight gain or inadequate growth, height gain. It also have an impact on the overall IQ. It also has an impact on the mental development of the kid as well. So nutrition is a very vital thing. Strong nutrition, recommended good nutrition in first 1,000 days of life, and good outcome we can see, and that is what which decides how the kid will come up or shape up in the coming days. As I said, Asia has the largest number of malnourished children, which accounts to almost 40% of the malnourished children in the world. 1 in 3 of world's malnourished children lives in India because of various reasons. But we have seen a significant improvement in terms of health education from where we were in 1947 to 2022. But we have a greater battle to fight, and it's going to be a long battle because of the situation which we are going through from last 3 years. The financial things, the inflation things, all are adding up to this malnourished group of kids and in the population. So we have to come together and we have to focus and contribute from our end in terms of educating the parents, in terms of guiding them what is appropriate, in terms of telling them what is cost-effective way of handling all these kids, and telling them the right set of nutrition. Stunting in children, basically, if a kid is supposed to grow, say, a 4 feet height, because of lack of nutrition, if they grow only 3 feet, that is called stunting. I mean, they are unable to gain the expected or potential what they are supposed to gain for that particular age for that particular period of time. So that can lead to chain of events which has been depicted in the slide. A kid which is supposed to grow, they have not grown because of lack of nutrition. That will have impact, as I said, lack of nutrition also have impact not just on the physical growth, it also has an impact on the mental growth. So education gets affected, their opportunity to get a good position, a good earning in their professional life gets hampered. And again, they malnourished kid will become malnourished parents and they lead to malnourished kids. The generation, this vicious cycle continues. So it is important that we need to focus on adequate nutrition and we need to focus on what is the right choice of nutrition which we need to give. And that's the reason why monitoring of growth and development in the initial 5 years of life plays a crucial role. And that's the reason why every pediatricians, they would first check the weight of the child, length of the child, and then head circumference up to the age of 2 years. And that is how we monitor the growth, and we have to give them. But just giving them carbohydrates of one piece of bun will not suffice the adequate growth. But we need to focus on a complete nutrition which will have impact on their overall outcome. So birth weight, I mean, if you start early, as I said, even before the delivery, if the mother nutrition, maternal nutrition is taken care, if soon after, if the birth weight is good, that has an impact on the outcome as well. And we have seen in our practice as a neonatologist and the practicing pediatrician that if extreme premature babies do have a lot of high risk in terms of feeding intolerance, in terms of infection, in terms of overall growth and development, developmental delay, a lot of things has been seen. So birth weight, they have a direct impact on the long-term outcome of growth and development. And that's the reason why giving them adequate nutrition when they're growing, if they are premature babies, if they are term babies with certain complications where the birth weight is hampered or affected. So in all these kids, we need to focus. And kids who are born normal with good birth weight, we need to focus on them as well with the recommended dose of certain micronutrients, which I'll be talking about in my later slides. So we need to emphasize on maternal nutrition to sum up, and we need to understand that birth weight is an important determinant of infant mortality. 2/3 of all deaths occurring in first 28 days, they happen due to low birth weight, and we all know these statistics. And I was talking about the maternal nutrition. So there are a lot of studies which has been done about checking the maternal nutrition and the outcome of the kids, comparing with good maternal nutrition versus the growth of fetus and the newborn baby birth weight. So it has been clearly documented in various studies that maternal nutrition plays a very crucial role in terms of the progress of pregnancy, outcome of pregnancy, and even the birth weight of or the healthy status of the newborn as well. So the study which suggests that good total protein serum albumin level in the mother reflects the serum albumin level of the baby, and which has got a favorable outcome in terms of the nutrition of the kid. And also the APGAR score. And we all know that lower the APGAR score, the risk on complications of growth and the mental development might get affected from this. So nutritional status of the mother plays a crucial role, and it will impact on the newborn outcome. So promoting optimal nutrition to ensure a good fetal development and reduce the risk of pregnancy complication, reduce the risk of outcome of the pregnancy in terms of reducing the premature labor, low birth weight babies. This all plays a crucial role. If we are focusing on the maternal nutrition, we can reduce all this. So micronutrients, I was talking about the nutrition. Macronutrients, you have carbohydrates, protein, fat, and micronutrients are minerals. Basically, micronutrients, these are required in a very minimal quantity, but this plays a crucial role in terms of the biomechanics which happens within the body. So micronutrients like zinc, iodine, iron, selenium, copper, vitamins E, C, B2, B6, folate, these are all, we know that. So prime importance is building children's bone bank account. That basically, if you keep on depositing the recommended quantity of calcium, right combination of phosphorus with calcium, vitamin D3 levels, So this all helps in restoring a safe bone bank, which helps in giving them an adequate growth spurt and adequate height, and so that the kid does not go into any sort of stunted growth. So choosing the appropriate nutrition, appropriate supplement plays an important role as a pediatrician, practicing pediatrician, in helping build the bone bank of the child. So effect of nutrition, which I've already emphasized, it affects both the linear growth, weight of the baby, and the psychological or the mental development of the kid. So we focusing on nutrition of mother, nutrition of the newborn baby, and focusing on nutrition in the first 1,000 days plays an important role in getting the best of the kids. So essential nutrition for a good bone bank is vitamin D, calcium, phosphorus, magnesium, and zinc. Vitamin D is very important. We know that which is crucial for the absorption of calcium from the food what we give to the kids. And we do get vitamin D production happens in our body when we get exposed to sun, when we take food rich in vitamin D, breast milk. So these are the few resources where we do get vitamin D. But vitamin D is very important. It's an anchor in balancing the calcium and phosphorus balance, and it also helps in certain increasing the immunity of the kid, the immune process as well. So vitamin D, there are a lot of studies which has been done. Various research is still on knowing the potential of what vitamin D does in human body. So if vitamin D level goes down, there are certain values, we call it as deficiency, insufficiency, excess, or normal values. So deficiency, we call it if it is less than 20. Insufficiency if it is between 21 to 29. Normal is above 30 is normal, above 100 is excess. So we need to keep the vitamin D level at an appropriate levels, and when we are suggesting the vitamin D supplements. So, and as I said, it is the most important hormone required for the major skeletal health of the kid. So stunting, poor growth in less than 5 years is a major challenge, and vitamin D levels is associated with stunting and poor growth, as I mentioned. So vitamin D, there are a lot of recommendations which have come, and that's the reason why we do start vitamin D supplement soon after birth with 400 international units as a maintenance dose throughout. And this has been recommended by various organizations like American Academy of Pediatrics, our own Indian Academy of Pediatrics, CDC, WHO. Everywhere they do recommend the daily dose of vitamin D supplements. As a pediatricians, we need to give them insight into the importance of vitamin D, how it is helpful in anchoring the good skeletal growth, in anchoring the calcium and phosphorus metabolism. As I said, 6 months to 2 years is the time when, because we as an Indian, we have various cultural background from south, north, east, west, so and center of India. So we have different food practices, eating practices, cultural practices among us. So whichever food we choose, we need to keep in mind that all these micronutrients are also covered in that. It's not just vitamin D alone, even the other micronutrients, and not just the macronutrient, but just giving carbohydrates and not giving adequate quantity of micronutrients can have a huge impact in their overall outcome. And even simple, if iron supplements are not, which is the commonest deficiency in Asia, between the age group of 2 to 6 months to 2 years. So we need to focus on, even though we have a different cultural practices, different food or eating practices, we need to have an idea, and we should give an idea about parents, what is rich in what, with their food, what they offer to the kids. So the growth rate of second trimester, second semester of life is lower. As I said, first 3 months, 1 kg per month, 4 to 6 months, half kg per month. And the second half from 6 to 12 months, it's just 250 grams per month is what we expect. So it goes down. So majority of the weight gain happens in first 6 months. So emphasizing on exclusive breastfeeding, emphasizing on the importance of good nutrition to the mother, which will in turn have a good quality breast milk, is very crucial, and which will have a huge impact in their growth in the first half of the first 6 months, 0 to 6 months. At 2 years, we have WHO charts wherein we have to chart it every time when they visit us about their growth and development in terms of checking their length, head circumference, and weight. We do check head circumference up to 2 years of age, but majority of it happens within 2 years. The brain growth 80%, and by 5 years, the brain growth, physical growth will be almost complete and comparable to the adult brain size. But the maturation, understanding keeps happening. The psychological development keeps happening. So along with the nutrition to the brain also needs to continue throughout their life. So, so it is very important that the nutritional assessment has to be carried out, which I was talking about, measuring the length, weight, and head circumference, and guiding them what is normal, what is not normal, and helping them to achieve that particular weight by giving them appropriate guidance as a pediatrician is an important role. Vitamin D, we all know that, as I said, there are various roles which has been seen with vitamin D having in our body, which will help in not just the calcium and phosphorus metabolism. It is crucial for various other genetic expression, immunogenicity, endocrine things as well. So this is the thing which I was talking about: deficiency, insufficiency, sufficiency, excess, and intoxication values. Vitamin D response element, it's a DNA sequence expression. So if you give vaccination, there was a misunderstanding that it will have an impact on flu vaccine immunogenicity, but a lot of studies have shown that there is no problem in supplementing vitamin D along with flu as well. So these are the few studies which has been done, which has not shown any impact in the immunogenicity of flu vaccine when you co-administer with vitamin D supplements. So the safety profile, daily administration of vitamin D for 4 months from the time of injection of first dose does not significantly modify the antibody response evoked by influenza vaccine. Nutritional sources: breast milk, sun exposure, fortified milk, and fortified foods. See, practically it is difficult to keep, in a place like Bangalore, sometimes we do have all the 3 seasons in one day. Sometimes it will be hot, sometimes it will be cold, sometimes it will be rainy. But maintaining the micronutrient status in a normal level is very important for the overall growth and development. So catch-up growth is noted through this, which I've already mentioned. So the period of lifespan required for a specialized case, especially in the premature babies, since they're born early with weight which is appropriate, or if it is less than their weight for their particular gestational age, we need to focus on their catch-up growth up to the age of 2 years. We need to look on their skeletal growth, and we have seen extreme premature babies who have not been focused on this particular aspect. They come with multiple fractures. They come with soft bones, crack skull. There are a lot of things which has been observed, but now the incidence has come down because of the awareness in the pediatrician and neonatologist to focus on the catch-up growth, not just the physical weight and length, but even on the micronutrient aspects, which has changed the overall catch-up growth, what we note in premature babies. So calcium, phosphorus is like husband and wife. So right combination is required, and the right combination is 2:1 combination, anchored by the vitamin D, which helps in balancing the calcium and phosphorus level in the body. So giving the appropriate combination of calcium and phosphorus, like 2:1, which helps in absorption, which helps in good skeletal growth, plays a very vital role in terms of having a healthy bone in the kids. So perfect combination of all the things which I was talking about, and guidelines also I've spoken about. These are the recommendations which are given for the daily intake of vitamin D supplement. Thank you. I hope to sum up, focus on micronutrients, especially the vitamin D, which is the topic for today, and to have a brief idea about the overall growth and development, normal growth and development, what we see in kids from 0 to 1 year, 4 to 6, throughout their childhood, from infant to adolescent growth. That is what we focused on, and we also understood that nutrition comes right from the nutrition of the mother, and nutrition should be maintained throughout their growth spurt, and first 1,000 days being crucial. We have to focus both on macro and micronutrients. And coming to vitamin D, we know that vitamin D it's a very vital organ, and it helps in anchoring the metabolism of calcium and phosphorus, which in turn keeps the skeletal health intact, and which in turn helps in good growth, a potential, whatever potential kid has. The kid will never die with a lot of music left in them if the micronutrients are given. And we have also seen that on a long term, if there is stunting, if there is malnutrition, how it affects their education, academics, and their overall psychological development. And as an adult, a good quality of adult, a good opportunities which they do have with the proper potential growth is what we have observed. Thank you.
Thank you, Dr. Prashanth. That was wonderful session, extremely comprehensive and interesting session. And I can see the questions already pouring from our delegates. So we can start. So yeah, Dr. Parik from Mumbai, he wants to know whether it is essential to supplement vitamin D even in exclusively breastfeeding.
See, when we say exclusively breastfeeding, why importance is breast milk has everything. If you're able to maintain good health of the mother, this is a very tricky question and very difficult to answer as well. But if mother nutrition is good, and if mother is exclusively breastfeeding, nature has always designed baby specific, mother specific, species specific breast milk, which is good enough for the adequate growth and development. But mother's nutrition needs to be checked, and mother nutrition needs to be advised in a proper way.
Right, sir. Another interesting question, sir, from Dr. Patil, Pune, that mainly the carbohydrates, proteins, and fats are basic building blocks. And does the diet of parent can affect the child nutrition?
Sorry, I didn't get it.
Does the parent nutrition or parent diet affect the child nutrition?
Yeah. As I said, see, the nutrition starts from the time the conception happens, from ova and sperm fusing, forming 2-cell stage, 4-cell stage, or 16-cell stage, what we call as marula. The growth and the first 3 months, where folic acid supplement is so crucial. If it is not given, it will have impact on neural tube development. Overall, if maternal hemoglobin and the weight of the fetus has been, a lot of studies have been done, and even post delivery as well, we advise, WHO recommends to continue mother to take iron supplement and calcium supplement as long as they breastfeed. So obviously, nutrition of the mother parent will definitely have an impact on the baby. And see, it's like even when they are off breast milk, say after 2 years, the practice what the parents does will be followed by the kids. So we need to have a healthy nutritional things taking every day. So obviously, right from the beginning, throughout the life of the kid, good nutrition of parent makes a huge impact.
Right, sir. Thank you for that. There is a question. So what would be the, so is it the vitamin D supplementation can be started in premature infants, premature babies, and then what would be the dose, the ideal dose for in that case?
Yeah, that's what. We start with 400 international unit. That is what our Indian Academy of Pediatrics recommends. So that is the dose what we look at. And there are few studies which has been done where the dose has gone up to 800 international units as well, or up to 1000 international units. But at least 400 international units needs to be started if we are, if there is premature babies, and because we'll be constantly monitoring their bone metabolic status by checking their phosphorus, calcium, vitamin D levels. So supplementing 400 international units, of minimum 400 international units is a must, which will definitely help in babies to have a good skeletal growth in extreme premature babies.
Yes, sir. Lot of questions on vitamin D. Another very interesting question, sir. So from Dr. Madan, is supplements is the only way to improve nutrition?
See, I am very neutral. If we are able to give a good diet with good balanced diet and focus, because I practice in Bangalore, and most of the parents who come to us, hardly they meet their kids 1 hour or 2 hours in a day, and most of the kids are grown with the mates. There are a lot of practical challenges which we see in cosmopolitan cities. But if technically, if you ask, nature doesn't want any of us to supplement with medications or things which have been done by human beings. But unfortunately, we don't understand the nature and we ignore the nature most of the time, and that's where the deficiency come, and that's where the supplements which has been created, which will help in reducing it, those deficiencies. But if nutrition is maintained well of the mother and the baby with the right set of food ingredients, definitely you don't require. But practically in our practice, we all know that, especially when you're practicing in a places where, or in a family where it's very difficult to focus on the nutrition, supplement plays a crucial role. If we have iron deficiency, we have to supplement with iron supplement. If vitamin D deficiency is there, that is when we give the vitamin D sachets or syrup with 60K weekly dose for 10 weeks, like that, to clear the deficiency. But if we are able to maintain with our natural food ingredients, we may not require, but practically in our practice, it is not possible.
Yes, sir, that is, I think, the most practical challenge, right? Another interesting question, sir. In the patients or the babies with cerebral palsy, is there any role of vitamin D3? And if yeah, at all,
I think
what would be
the question is taking to a new discussion. That's going to be a separate discussion as well, because as I said, there are a lot of studies which are happening. They're studying in terms of what vitamin D can bring in mental development, bone development. We all know that, gene expression, immunogenicity. So that itself is a different topic. I think we will stick to our thing today.
Sure, sir. Okay, maybe a similar sort, like if at all, like there are chances that fourth wave of COVID might be coming to India. This is from Dr. Samantha. So can like in adults, vitamin D3 supplementation for immunomodulation and all was there. See, so for children, it is.
As a doctor, I don't, unless we have a data, and which is because Corona is just 2-year-old, and we are not sure about the long-term outcome of vaccines what we have taken already. So since it's very new in this platform where all of us are there, all of well-read people are there, we have done phenomenal practice achievements in various platforms, and even in our prestigious IAP society or NNF society as well. It is not correct to comment on things with without the research in hand. So I do not know about the vitamin D versus prevention of corona. I'm not going to comment, and I don't have any data regarding that. So it won't be appropriate to comment on that particular question.
Right, sir. Uh, uh, Another question, another on vitamin D. So what would be the dose of vitamin D in rickets? The,
Yeah,
the
I mean,
initial and yeah.
we do have, say, rickets, the various forms of rickets, nutritional rickets, metabolic rickets. We have different forms of rickets. I think that's a different topic altogether, where, today's focus is on giving the importance of vitamin D in from beginning till throughout their growth. We need to focus particular thing on. When it comes to the disorders, we have a specific recommended dose, and we need to look at what type of ricket it is, and based on that, the dose and protocol is there. We need to follow that.
Thank you, sir. So another question is apart from like vitamin D, so what are other micronutrients supplement could be recommended?
Calcium, iron, zinc, folate, if there is malnutrition. If usually we tell all this selenium and things, we advise them to give nuts, which has got good, sufficient quantity to supplement. Mainly the iron thing, from 6 months to 2 years, we have to focus on and supplementing it, and calcium and vitamin D. These three things are the major things in our practicing, which we can tell them, and which we can supplement also if there is any deficiency. Focus on iron, don't forget on iron, don't forget on calcium, don't forget on vitamin D. These three things should be remembered as a practicing pediatrician.
Okay, thank you, sir. And I think we can take one more. So how long these supplements can go, especially vitamin D supplements, how long it can be taken by the children?
We do recommend till 1 year of age, and then based on the status later after 1 year, checking their vitamin D and calcium and phosphorus status. Based on that, we continue if there is any deficiency.
So I think, yeah, thank you, sir. That's all the questions. And yeah, there is one more, sir. Just now it has come from Dr. Nikhil. How to approach when child not getting rid of breastfeeding, and instead of breastfeeding and not no to any other food?
No. I mean, see, 0 to 6 months, body needs only the breast milk, which is good enough to give a sufficient growth because that has all the ingredient. But after 6 months, adding complementary food, because baby needs other supplementary food, both macro and micronutrients in the form of weaning food or complementary food, what we call, it has to be brought in practice. And one of the studies, interesting study is if during pregnancy, if mother has been taking certain type of vegetables, fruits, and if our nutrition is maintained, baby, it has been seen that it gets secreted into the amniotic fluid as well. So they get accustomed. There was a study, very interesting study, which was done on a mother who had consumed carrot during the pregnancy, and complementary food was started after 6 months. And those mother who had consumed the kid also had it was easy to do the transition of milk to other food items which mother was taking, versus mother who had not taken in few of them. So emphasizing on good nutrition during pregnancy and asking the mother to take various type of fruits, vegetable will definitely have an impact on the fetus. Plus, it will also have an impact when we are starting the weaning food. So difficulties in changing from liquid form of milk, which we're giving from 0 to 6 months, to along with that, if you're adding semi-solid and then solids later, it is a greater challenge. There is no set protocol as such, because every kid is unique, every family is unique. They have their set of practical issues and problems. So I cannot blanket say that you follow this, it will help. But try again till you succeed, because we are dealing with nutrition. we cannot just allow kid to have only milk till the age of 2 years, because we will be taking away the potential growth from the kid if just milk is given, if only breast milk is given throughout 2 years of age. So adding complementary food, because body needs it, all type of complementary food after 6 months. Keep trying it. I don't have an answer, a single answer for that, but keep trying till you succeed. Keep educating the mother. Keep trying various type of food items, because we have from dosa idli to dokla to, that is a beauty of India, where we have various food items. I suggest my parent, when the kids of the kids parent try to try with different food items. I've seen Punjabi kids liking dosa and idli. I've seen Karnataka kids liking dokla. So try. You have access of different recipes now. You have to become master chef and keep trying. But keep trying. Keep giving nutrition. Don't allow them only milk throughout 2 or 3 years, which is not correct.
Thank you, sir. Thank you for a very enlightening session, as well as very patiently taking all the questions. It was in the real sense that there be a light, and we are all enlightened by your talk, sir. Thank you very much. Apart from that, I'd also like to thank all our delegates who have attended this session, and it was very interactive. We can see by the questions. So thank you all, and have a good night. Have a nice weekend. Thank you very much. Thank you, sir.
Thank you. Thank you for the opportunity. Thank you for all the viewers who have joined. Thanks, my dear colleagues. Thank you. Dave, you are mute.
You stopped. Recording is stopped, Shraddha, right?
Yeah, it's on. So thank you, Prashant sir, for this enlightening session, and thank you for giving us the opportunity to discuss on a very relevant topic, that is growth and nutrition. I'm very much sure the questions that has been coming up from the delegates, and the discussion has been very enriching, and this will benefit all the children, all the parents as a large as